Health officials are concerned with how fast the Delta variant, first detected in India, is spreading across the U.S. The highly contagious strain is now linked to over 50% of new COVID-19 cases. Experts are now warning that a, quote, surprising amount of deaths could soon follow. Meantime, Pfizer will meet with top U.S. health officials today to discuss the need for a vaccine booster shot, but the meeting comes after the CDC and the FDA doubled down on their recommendations that a third coronavirus shot is not necessary at this time. For more on this, let's bring in Dr. Ron Elfenbein, who is the medical director and owner of First Call Medical Center. So, Dr. Ron, the Delta variant now accounts for more than half of new COVID-19 cases in the U.S. How do you expect this will impact the nation's recovery from the pandemic? Could we say that we're recovering if we've got this spike that is happening in parts of the country?
Yeah, that's a good question, Vlad. It's hard to sort of generalize because the United States is so varied, as you just said. You know, there's some states like my state of Maryland that has a very, very high rate of vaccination, and other states that have incredibly low rates of vaccination that would actually put them amongst the lowest in the world. So, you know, it's hard to generalize. Yes, the Delta variant is very concerning, as are the other variants that are coming out, the Peru variant and others. You know, the Delta variant is roughly 220 to 250 times more infectious than the original strain that we saw that first started this whole pandemic. Not necessarily any deadlier, but it's certainly way more infectious. So that is problematic. You know, that means that we really need to be more vigilant and careful, and we really need to get our vaccination rates up.
So, as we've been pointing out, Pfizer plans to meet with top U.S. health officials today to discuss federal authorization of a third dose, a booster shot of the vaccine. Earlier, Dr. Anthony Fauci discussed the discrepancy between them, the CDC, the FDA, about whether or not a third shot is actually needed, because we know the CDC and the FDA came out with this joint statement last week saying that they didn't feel a third shot, a booster shot, was needed at this point. Here's what Dr. Fauci had to say.
When you have a regulatory agency like FDA or a public health agency like the CDC, whenever they make solid official recommendations, they will do that based on solid data and evidence that they've gotten from clinical studies, which they are very actively accumulating right now, and will utilize that data to ultimately make recommendations. What Pfizer did, understandably, they looked at what their data and they say, hey, you know, based on what we see, we think people should get vaccinated with a boost. Well, that's fine, except they're not the official recommending organization. So although they do good work, they have study and data that we will go over with them to determine if there's anything there that we need to use. But you're talking about the difference between an organization whose responsibility is to make an official recommendation based on data, and a pharmaceutical company, as good as they are, who look at their product and say, hey, you know, we really think you need to get a booster shot. So there is a difference there.
I find his actual response really interesting. Because I thought that, you know, the FDA sort of leaned heavily into the research that the drug manufacturers produce to come to their conclusions. But I could be wrong about that. You would know more about it than me, Doctor. I'm curious, you know, what's your take on this? What's the likelihood, do you think, that maybe people who got the Moderna shot or the Johnson & Johnson single shot may also have to receive a third shot, perhaps from Pfizer?
Yeah, and I know that this is very confusing for people because they look at this and they say, well, who do I believe? Who do I trust? You know, what's going on? And Dr. Fauci actually is, you know, has a very good point. You got to remember that Pfizer, for all that they do and all the wonderful things that they've done, and the fact that they were able to produce this vaccine, which is amazing, they are in the business to make money. And this, you know, getting a third booster shot is basically saying that they need to sell 8 billion, you know, however many billion doses of another vaccine, which is a tremendous boon to their bottom line. So, you know, there is the profit motive there as well, which isn't necessarily a bad thing, but it's something that you have to consider. And Dr. Fauci is correct when he says that the FDA and the CDC, both organizations, have to look at the data. Now, I think what Pfizer's looking at is some of the data, recent data that came out of Israel, which was fairly recent and is preliminary, but it showed that the efficacy of the Pfizer vaccine, which is the only one that's used in Israel, dropped as soon as the Delta variant became the #1 variant in the country, dropped from about 90+% efficacy to 64% efficacy. But I think the important point is that it's still 94% effective at keeping people from getting seriously ill or needing hospitalization. So the efficacy dropped in a subset of people in a small country. Just from the study was looked at from June to July, so it's only 1 month. So you got to take that into consideration when you're looking at the totality of data for the rest of the world that's been accumulated. That in and of itself doesn't necessarily mean that we need to do a third dose. Do I think we're going to have a third dose? Yes. Do I think it has to happen right now? No. I think it will happen in the future, and I think Pfizer is trying to be proactive, to their credit, and trying to say within 6 to 12 months of getting your second dose, you will likely need a booster shot, and I think that is the truth. I think that is what will end up happening. But we'll have to wait and see as more data becomes available and the CDC kind of weighs in on it.
So I don't know if you've seen this, Dr. Elfenbein, but an autopsy of an unvaccinated woman in Belgium has revealed that she was simultaneously infected with 2 different strains of the coronavirus. What do we know about these kinds of infections? Has the medical community seen this before? And of course, it's just one person, but it is kind of interesting.
Yeah, it's very interesting, Vlad. And it actually, believe it or not, this poor woman, she was 90 years old, and she actually, she died in 5 days after getting diagnosed. Within 5 days, she was dead. And this was back in March. So we're hearing about it now because they're studying her and they're doing some autopsies and they're actually publishing the data on her. Your question about how common this is, we don't really know. We don't believe it's very common at all. If you look at most viral infections, when people get infected with something, whatever the case may be, they very rarely get a co-infection. It does happen, but it's not very common. So presumably, this woman got infected by 2 different people because she had 2 different strains. She had the South African strain and the UK strain, both inside of her at the time of her death. So presumably she was infected by 2 different people. Again, very unusual, we think, but not necessarily unheard of. So we do believe that this does happen, and that it's probably undercounted in terms of how widely distributed this is. Again, in the United States, we've talked about this before, but we don't do very many. We don't do a lot of genetic sequencing of positives. The rest of the world does a much better job than we do here in this country. So we don't really know how many people like this there are because we just don't look for it. We probably should be, but we're not doing such a great job at that.
Doctor, the start of the school year is a couple months away. The CDC has updated its mask guidance for children returning to school. It says that those who are vaccinated do not have to wear masks, but unvaccinated students are encouraged to wear them. Your reaction to the guidance?
I actually think the guidance is great. Remember, it's just that. It's guidance. And what the CDC said was, look, we're just going to make recommendations here, and you as the local school district, the state, the county, whatever municipality, however your local area does that, you guys get to decide what you want to do with this. We're just going to tell you what we think you should do, and then it's up to you to decide what you want to do. So you have states like California that have said that they're not going to lift the mask mandate for anybody. Everybody's going to still have to wear masks. You have other states where the entire state said nobody's going to wear masks. So it's really leaving it up to the locals, which I think is very wise, and it's the way it should be. The recommendations, as you said, Anne-Marie, it's if you've been vaccinated, you don't need to wear a mask. If you're not vaccinated, you do. Although everybody on a school bus still has to wear masks as long as they're on the buses. And of course, they recommend still maintaining 3 feet of social distancing when possible. And they also recommend weekly testing when possible, which all these things are great recommendations, but it's really up to the local area. As we said earlier, some states have great vaccination rates, some states don't. And some states have very high positivity rates and some states don't. So it's really, let the locals determine it based on what they're seeing in their own areas. And they can be fluid and they can change. And that's great. And, I think the CDC was very wise.
Right. Dr. Ron Elfenbein, thank you so much.
Thank you, guys. Stay safe.